Why is large cell carcinoma hard to diagnose early? Imagine trying to catch something that often shows no signs until it's already advanced. That's exactly what makes large cell carcinoma, a type of lung cancer, so tricky to identify early. This form of non-small cell lung cancer tends to grow quickly, but in its early stages, it usually doesn't cause noticeable symptoms. When symptoms do appear, they are often vague and can be mistaken for common respiratory illnesses like bronchitis or pneumonia. People might notice a persistent cough, mild shortness of breath, fatigue, or even unexplained weight loss. Because these signs are not specific to lung cancer, both patients and doctors might overlook the possibility of cancer, delaying diagnosis. Another challenge is that large cell carcinoma often doesn't form a clear, distinct lump that can be easily seen on routine chest X-rays. While more sensitive imaging like computed tomography scans can detect smaller abnormalities, these scans are not typically used for screening unless someone is considered high risk. Even when abnormalities are found, they may be too small or ambiguous, making it hard to determine if they are cancerous without further tests. This means that early detection depends heavily on the use of advanced imaging and suspicion, which are not always part of routine checkups. Getting a definitive diagnosis requires a tissue biopsy, which involves taking a small sample of lung tissue. This is usually done through minimally invasive procedures like bronchoscopy or needle biopsy, or sometimes through surgery. The tissue sample is examined under a microscope by a pathologist. Large cell carcinoma is diagnosed when the cancer cells are large and undifferentiated, meaning they don't resemble normal lung cells or other types of lung cancer like adenocarcinoma or squamous cell carcinoma. However, obtaining enough tissue can be difficult if the tumor is in a hard-to-reach spot or if the patient has other health issues that make invasive procedures risky. Even if imaging shows an abnormality, it can be hard to tell whether it is cancer or a benign condition just from pictures. This is because large cell carcinoma can look similar to other lung cancers or even non-cancerous lung diseases on scans. Without a biopsy, doctors cannot be certain of the diagnosis. Additionally, there are no reliable blood tests or biomarkers that can detect large cell carcinoma early, which adds to the difficulty of diagnosing it before it has grown or spread. In summary, early diagnosis of large cell carcinoma is challenging because it often doesn't cause clear symptoms, may not be visible on routine scans, and requires tissue sampling for confirmation. Its rapid growth and lack of specific early signs mean that catching it early depends on vigilant screening and suspicion. Regular low-dose computed tomography scans are recommended for those at high risk, such as long-term smokers, but even these can sometimes miss early cases. Because early detection is crucial for better treatment options and outcomes, understanding these challenges highlights the importance of ongoing research and awareness. Always consult healthcare professionals for personalized advice and screening options tailored to individual risk factors.